Mosquitoes, and for my freshman seminar interview project, I'm interviewing my sister Allison. Say hello.
Hi, how are you?
Okay, so the first question, what is your occupation?
So I'm a social worker.
And what is the name of the company that you work for?
Boston Medical Center.
And what type of industry is it?
It's a hospital or healthcare.
And how did you first become interested in this type of work?
So my grandfather was, or our grandfather was a social worker, and I've always been interested in it. And then I interned when I was in college at DSS, and I really enjoyed it. So I decided to continue my education.
Okay, and so what are some of the jobs you had prior that led to this job?
So I did a lot of internships in the social work field, but jobs, I worked at DSS in London for 2 years. I worked at Brigham and Women's for a little over 2 years, and then I've been working at Boston Medical Center for over 2 years.
Yeah, and what do you do on your job?
So I'm a clinical social worker, so I do therapy sometimes with people who are newly diagnosed or dealing with depression or anxiety. I do genetic counseling, and I also do some case management.
Okay, and what type of education or training or license do you need to get this job?
So you need a master's degree of social work, and then you need to get licensed. So you first get licensed with an LCSW, which is a licensed clinical social work license, and then after 2 years of practicing, you test for an LICSW.
Okay, what is a typical day for you?
So a typical day when I'm in clinic, I sometimes have my own patients that are scheduled for therapy, and then in between that time, I look to see who the doctors are seeing and if there's any patients or families that may be interested in talking to me. So patients that are newly diagnosed or that may be young or have a history of depression or anxiety, and then I'll go and meet with them and talk to them about what I do.
Okay, so what are some of the working conditions of your job, like the hours, the setting, and the traveling?
So typically I work Monday through Thursday, 8 to 4 in the office, but I also work with the American Parkinson's Disease Association. So I sometimes do support groups in the evening or on the weekend, so it's not always in the office.
Okay, and what do you like most about your job?
What I like most is I really love doing group work, so I like being able to lead some groups as well as working in a lot of different settings within the hospital.
Yeah, and what do you like least?
That people expect that I will be able to solve every problem and answer every question.
Yeah, that's nice. What are some of the benefits that your company gives you?
So I get a retirement, I get health care, I get short-term and long-term disability, I get vacation pay, and then other type of benefits they give.
What is the size and location of your company?
It's about 9,000 employees, and it's in Boston, Mass.
And what type of technology do you use to communicate with your fellow workers?
So we use a paging system, and then we use a computer system called Logician, and then we use email and internet.
If I wanted to be in this career, what could I do to enter this field to get some experience now?
You could do some internships or volunteer at places that may do some community programming, like hospitals or YMCAs or things like that.
And for high school, are there any classes that I could take to prepare myself for this kind of job?
Well, my first class that got me interested was sociology my junior year in high school, so something like that would be good.
Yeah. And then do you think you would ever switch jobs, and why?
I think if I was ever going to switch job, I would stay in the healthcare field, so maybe like nursing or something like that, but I don't think I would switch to business or something like that.
Okay, well, thanks, Allison, for taking my interview, and yeah, okay, bye.